huge chunks of society are wedded to the cult of scientific materialism.
Yeah.
So basically, the line I use, if it's not measurable, it doesn't exist.
Yeah.
So what happened about 30 years ago or so, the cognitive behavioral people were sort of out on the fringes of psychology. And while they were out on the fringes of psychology, they were doing research. So suddenly they came in with their research going, this works really well for depression, right?
Mhm.
The arrogant, stuffy old psychoanalysts weren't doing the research because they had the dominance of
Yeah.
everything. And suddenly they were caught with their pants down, so to
Right.
speak. In London, some Lord economic guy, I think it was I can't remember, Lord Leonard, he came up with a depression report. So again, linked to capitalism, he worked out that if you got people off benefits and back to work, it would pay for the therapy itself. So they were taking CBT, which wasn't the delivery model of CBT wasn't like 6 sessions, but in the UK they were offering people 6 sessions, 12 sessions with this idea of getting them back to work. So there was that, and CBT in many ways was effective in certain areas for certain people and for certain things, right?
Hmm.
Uh, in comparison to old stuffy old psychoanalysis, right? So it was a bit of a like, here's the new kid in town, and everybody went all in on it. But
Mm.
I think it was in a certain context, and it then became an assault on interiority. You know, if you're a neuroscientist, you don't want to talk about consciousness because
Yes.
it'll sound woo-woo, right? You want to talk about measurable brain activity. Now, when you go full circle back to Mcdonaldization, CBT fits perfectly
Yeah.
because it's predictable,
Yeah.
calculable, it's efficient, it's controllable, right? Suddenly you're saying, what, 3 or 4 sessions a week of psychoanalysis versus 12 sessions of CBT with a start, middle, and an end. If you're procuring services, which are you going to pick? But the truth is, a good CBT clinician in London wasn't doing just CBT. They were also using the system, right? They
Okay.
were often doing what the patient or client needed.
Hmm.
So I think this CBT fits very well. I mean, in London back in the day, if, your first therapist was a CD. They used to give people a CD with CBT on it, and then you got the therapist. So
Ah.
all fits very well with technology, all fits well with scientific materialism, all fits well with Mcdonaldization.